My name is Dr. Louis Grandin. I'm a Canadian physician. I was diagnosed with stage 4 cancer of the bowel. In my specific case, I chose not to get chemotherapy and not to do unnecessary ablative surgeries. They are both detrimental to cancer survival, specifically chemotherapy. Chemotherapy is an indiscriminate poisonous substance that is introduced in the body, and it will damage more of your immune system than your cancer cells. I've been here at the clinic for 6 weeks. The reason it's 6 weeks is because it represents 2 cell cycles, and literature supports the fact that treatment, whether it's insulin potentiated chemotherapy, hyperthermia, and so forth, should be provided for a consistent 6 weeks period, which is 2 cancer cell cycles. So I've been here for 6 weeks, and I have to say that my energy level is close to its normal. I'm at 99 point something percent. It's close to what it normally is. I exercise an hour every day, which is what I usually did before my diagnosis. I've put on weight. I was 164 pounds when I came in, and I'm now 181 pounds. The analysis of my BMI indicates that it's mainly muscle mass, which is what I had lost during the process in Canada. The care here in this clinic, I have to say, has been excellent. It has exceeded my expectation, and I've had beyond great care. The nursing staff work as a team, the physicians work as a team, and they have delivered more than what I expected when I initially came. Perhaps the main reason I chose Verita Life is that you have a stimulus, a stimulatory treatment for your immune system, and you also sensitize dendritic cells to your cancer antigens. This is a rather complex treatment with which both Dr. Cardenas and Dr. Enriquez have a lot of experience, and they work with a laboratory who basically comes twice. They extract 350 cc's of your blood. They separate the red blood cell fraction from the white cell fraction from your plasma. They re-inject that red blood cell fraction that same afternoon, and they incubate the antigens in your plasma with a fraction of your white blood cells, the dendritic cells. The dendritic cells then absorb or attach themselves to the antibodies of your cancer cells, and they re-inject you with this. They create a vaccination fundamentally against your specific cancer. That also is a very important or key treatment, because cancer is a problem. It's a life-limiting problem. But that is not the only problem. The main problem is the fact that the immune system did not recognize it. After the age of 50, we make easily 100 cancer cells a day. Our immune system recognizes that and eliminates that. When someone presents clinically with cancer, the main problem is the immune system missed that window, did not recognize it, and the cancer has grown to a significant mass. So immune stimulation against that specific tumor or cancer is key, and that is an important part of the treatment here at Verita Life. In the case of Verita Life, the first thing they do is they put you on a ketotic diet, a diet which limits the amount of circulating glucose, which is the only fuel upon which cancer cells can survive. It's a difficult diet to manipulate, it's a difficult diet to present, and I have to recommend the cooks here, because they make it very palatable, very delicious, and very easy to transition into it. The second thing they do is they do regular hyperthermia. Once a week you get full body or whole body hyperthermia, which raises your body temperature to a point where cancer cells don't survive. They don't survive for several reasons. Number one, they do not have enough blood supply to vasodilate and to cool down, but also cancer cells, like several types of bacteria, are very sensitive, very labile to temperature shifts, specifically hyperthermia. And once a week you get that. The rest of the time, every day, you get local hyperthermia, which in my case has allowed a reduction in the girth of my abdomen and in the discomfort I was feeling, because I had abdominal carcinomatosis, so that was very useful. Once a week you get insulin potentiating chemotherapy. Cancer cells need sugar, and because they need sugar, they have 16 times more insulin receptors at their surface. So by giving insulin, they now become receptive to whatever circulates in them. They reduce your blood sugar, insulin does that, and at a critical time when you are below 50 milligrams per deciliter, an injection of chemotherapy, 2 chemotherapy agents are performed. And it's a low dose of chemotherapy. It's anywhere between 1 to 30% of the normal dosage, but it's more targeted to cancer cells because of the insulin at their surface. They absorb the chemotherapy, and also because of the hypoglycemia, more cancer cells absorb this chemotherapy. So it protects the rest of your cells, specifically your immune system, from damage. And that is illustrated by the lack of complications. I haven't seen any patients here vomit or feel ill or feel sick after chemotherapy. The first thing I would recommend cancer patients to do is to research. There is no emergency. Your heart hasn't stopped. Your brain hasn't stopped. You've got time to research. I took 2.5 months to research, refusing any other treatments. So you have time to research. It is not a disempowering disease. It is an empowering disease. Choose well what treatments and where you get it, because treatment is available. Help is close at hand.